A lower body lift is a specific procedure to correct the abdomen, the upper outer thighs, and the buttocks. It's a little different in different surgeons' hands, and certainly doesn't always conform from one plastic surgeon to another as far as what we do. In my hands, a lower body lift consists of 5 different procedures. It's a tummy tuck, it's a mons lift. A mons lift is lifting up the sagging pubis area, which is frequent in massive weight loss patients. It's a strong lateral thigh lift. That means it lifts the outside of the thigh. It lifts sagging buttocks, but in my hands it also augments the buttock. I use the patient's own tissue to augment the buttock, and I have come up with a procedure used only by myself as of this time, called a hip flap, that I use to help widen the hip and increase their hip-waist ratio, therefore giving them more of a feminine look. Doing a lower body lift by itself, which as mentioned typically consists of 5 procedures in of itself, usually takes me usually about 6 hours, anywhere from 5 to 7 hours. I usually keep the patient in the hospital for 2 nights. And then the recovery is actually similar to a tummy tuck recovery, which is 4 to 6 weeks. They can drive at about 2 to 3 weeks. I want them to be very sedentary for 2 weeks. I use special beds in the hospital. It's called a sand mattress to take pressure off their buttocks. I do use drains, which are tubes coming out from the side of the body to help remove excess fluid. And I will usually remove these at about 7 to 10 days. Bariatric surgery is only a means to getting down to a weight that they want to. You have to change your lifestyle, you have to change your eating habits, and you have to keep this that way after the surgery. A lot of these patients start to exercise. A lot of them couldn't exercise before their massive weight loss. Now they can exercise. Unfortunately, I stopped them for 6 weeks, but then they get back to their exercising, and that helps with their results even further.